The cardiovascular system, blood vessels. Structure and function of blood vessels. Major circulatory routes. Anatomy of blood vessels. Closed system of tubes that carries blood. Arteries carry blood from heart to tissues. Elastic arteries. Muscular arteries. Arterioles. Capillaries are thin enough to allow exchange. Venules merge to form veins that bring blood back to the heart. Vasa vasorum is vessels in walls of large vessel. Arteries tunica interna, intima, tunica media tunica externa. Simple squamous epithelium known as endothelium. Basement membrane. Internal elastic lamina. Tunica media. Circular smooth muscle and elastic fibers. Tunica externa. Elastic and collagen fibers. Sympathetic innervation. Vascular smooth muscle is innervated by sympathetic nervous system. Increase in stimulation causes muscle contraction or vasoconstriction. Decreases diameter of vessel. Decrease in stimulation or presence of certain chemicals causes vasodilation. Increases diameter of vessel. Elastic arteries. Largest diameter arteries have lot of elastic fibers in tunica media. Help propel blood onward despite ventricular relaxation, stretch and recoil. Muscular arteries. Medium-sized arteries with more muscle than elastic fibers in tunica media. Capable of greater vasoconstriction and vasodilation to adjust rate of flow. Walls are relatively thick. Arterioles, small arteries delivering blood to capillaries. Tunica media containing few layers of muscle. Arterioles form branches into capillary bed. Capillaries form microcirculation. Microscopic vessels that connect arterioles to venules. Found near every cell in the body but more extensive in highly active tissue, muscles, liver, kidneys and brain. Entire capillary bed fills with blood when tissue is active. Lacking in epithelia, cornea and lens of eye and cartilage. Function is exchange of nutrients and wastes between blood and tissue fluid. Structure is single layer of simple squamous epithelium and its basement membrane. Types of capillaries: continuous capillaries. Gaps between neighboring cells. Muscle and lungs. Fenestrated capillaries. Plasma membranes have many holes. Kidneys, small intestine and endocrine glands. Sinusoids. Very large fenestrations. Incomplete basement membrane. Liver, bone marrow, and spleen. Capillary exchange, movement of materials in and out of a capillary. Diffusion, most important method. Substances move down concentration gradient. All plasma solutes except large proteins pass freely across. Through lipid bilayer, fenestrations or gaps between cells. Blood-brain barrier does not allow diffusion of water-soluble materials, nonfenestrated epithelium with tight junctions. Transcytosis. Passage of material across endothelium in tiny vesicles by endocytosis and exocytosis. Venules, small veins collecting blood from capillaries. Tunica media contains only a few smooth muscle cells and scattered fibroblasts. Veins proportionally thinner walls than same diameter artery. Tunica media less muscle. Lack external and internal elastic lamina. Still adaptable to variations in volume and pressure. Valves are thin folds of tunica interna designed to prevent backflow. Varicose veins, twisted, dilated superficial veins. Caused by leaky venous valves. Congenital or mechanically stressed from prolonged standing or pregnancy. Allow backflow and pooling of blood. Extra pressure forces fluids into surrounding tissues. Nearby tissue is inflamed and tender. Deeper veins not susceptible because of support of surrounding muscles. Blood distribution. 60% of blood volume at rest is in systemic veins and venules. Function as blood reservoir. Veins of skin and abdominal organs. Blood is diverted from it in times of need. Increased muscular activity produces vasoconstriction. Hemorrhage causes vasoconstriction to help maintain blood pressure. Circulatory routes. Systemic circulation is left side heart to body and back to heart. Hepatic portal circulation is capillaries of GI tract to capillaries in liver. Pulmonary circulation is right side heart to lungs and back to heart. Fetal circulation is from fetal heart through umbilical cord to placenta and back. Systemic circulation. All systemic arteries branch from the aorta. All systemic veins drain into the superior or inferior vena cava or coronary sinus to return to the right side of heart. Arterial branches of systemic circulation. All are branches from aorta supplying arms, head, lower limbs and all viscera with O2 from the lungs. Aorta arises from left ventricle, thickest chamber. 4 major divisions of aorta. Ascending aorta. Arch of aorta. Thoracic aorta. Abdominal aorta. Aorta and its superior branches. Aorta is largest artery of the body. Ascending aorta. 2 coronary arteries supply myocardium. Arch of aorta, branches to the arms and head. Brachiocephalic trunk branches into right common carotid and right subclavian. Left subclavian and left carotid rise independently. Thoracic aorta supplies branches to pericardium, esophagus, bronchi, diaphragm, intercostal and chest muscles, mammary gland, skin, vertebrae and spinal cord. Abdominal aorta and its branches supplies abdominal and pelvic viscera and lower extremities. Splits into common iliac arteries at 4th lumbar vertebrae. Coronary circulation. Right and left coronary arteries branch to supply heart muscle. Veins of the systemic circulation. Drain blood from entire body and return it to right side of heart. Deep veins parallel the arteries in the region. Superficial veins are found just beneath the skin. All venous blood drains to either superior or inferior vena cava or coronary sinus.